The management of the Lagos University Teaching Hospital has condemned the protest organized by some union health workers in the hospital on Wednesday over the allegations of insensitivity by the management concerning their unpaid salary arrears and poor working environment. In an exclusive interview with Television Continental, the Chief Medical Director of LUTH, Professor Chris Bode, says the health workers are being economical with the truth and have resulted to blackmailing the medical institution. Professor Bode described as untrue the issue of discrimination and non-implementation of government policies such as the new salary structure that the protesters mentioned.
Those who used to cause strike actions in LUTH every time, don't you feel sad that we were on strike for 8 months in 2014 and we got paid? Who got cheated? The public. We are the custodians of the safety on behalf of the public. We must say the way it is. We should not use strike actions for dispute resolution. They are being economical with the truth. If somebody is stagnated or stagnates, let's put it that way, on the promotion scale, everybody stagnates at a point or another. I can be promoted anywhere else. So that person has two options: to either accept what their station in life or move out to a better place where somebody may say, I need you, you become the director. Is that not so? But you love your job, you want to stay there, and you say they must promote you. So there is a conflict there. Since he joined LUTH, he has turned the heads off. Gave me a letter of warning. He went to court to tell the court that they should tell us I have no right to query him. The court told him, you are not here. He did many other things, including threatening to shoot people. So we thought this was a bit abnormal. As we speak, he's facing disciplinary actions. The day they invited him for this disciplinary actions, he said he would cause.
When you are ready, sir. Okay. Good day, sir.
Good afternoon.
Let's meet you. Your name, designation.
I'm Professor Chris Bode. I'm the Chief Medical Director of the Lagos University Teaching Hospital, Idiaraba.
Okay, good to have you. Sometimes on Wednesday, exactly 9:30 in the morning, we had about a protest in LUTH, and I was there personally, and I saw joint protest by nurses, lab scientists, resident doctors, even record officers. And when we asked them what prompted this protest, they said that LUTH is not working. They have serious issues with working environments. It's not conducive enough for them. Then the allowances. Some said the promotion has been stopped. So lots of allegations. I just want you to throw light into all those allegations.
Thank you, Tony. If you had looked closely, the group that held that press conference was not up to 15. The people there, the protesters. They were union officers, not the ordinary workers of LUTH. These union leaders have literally come together under the instigation of some people who have certain agenda against the hospital. Curiously, you will notice the hospital functioned completely that day. Our nurses, our doctors, our pharmacists, everybody, nobody joined that protest. So it was a well-staged surprise event whereby about 15 people went to a space within the hospital, suddenly unfurled banners, and started they had previously invited journalists and all that, and what they wanted was that airtime. LUTH has been working. There are no strikes in LUTH. And people are quite happy with the fact that the hospital is making good progress, and we are happy that we are contributing meaningfully to the care of Nigerians who come to our doorsteps for specialized medical care, because that, at the end of the day, is what the government is paying us to do. It's a battle of wit between those who want to perpetually cause strike actions in our working environment and those who say, no, you can't do that anymore. They had become disgruntled since government implemented the no work, no pay policy fully mid last year, about a year ago. What do I mean by that? In 2014, LUTH was on strike for 8 months, 40-something days, 43 days. We were on strike. And government used taxpayers' money to pay us. For me, that is not good. It's not right in the eyes of anybody. It's not right in the eyes of God. In 2015, we were on strike for 5 months. We got paid. But when government now said, if you don't work for it, you don't get paid for it, nobody believed it. In 2016, then government now told our striking workers, don't go on strike, and they did for 2 months. And suddenly, during that strike action, they were warned, no work, no pay will be implemented. They said, no, we will sort it out with government. We usually know how to do it. And government deducted their salaries. It was no more funny. Since then, everybody has learned. And various other groups that went on strike, doctors, GSU, they paid for it. Since then, they had been up in arms, saying all sorts of things that we deducted their money. I didn't deduct anybody's money. Government gave an order that anybody who participated in that strike action should not be paid, and they were not paid. I think we almost commend government for that, because government started acting boldly on behalf of Nigerians who should not be punished when I have an industrial dispute with anybody. We shouldn't punish a sick person. Since then, LUTH has been working so well. Our wards are full now. Our theaters are working. In May, and April and May, which has not ended, we've done 786 operations in the hospital. If you know the logistics that go into performing just one operation, you will commend us. Our theaters are working, our laboratories are working, everywhere is working. People are happy that, I've just told you that we did 8 open heart surgeries last week. They've all gone home. That is where we want to be.
Some of those protesters say that the environment in the theatre and the wards are not conducive. They even go for by saying that no gloves, no nose covers, and it's got me thinking, how can an hospital of that magnitude would not have all those simple things? I spoke with a doctor that said he operated on a patient, and because of the environment of the theatre, they had to bring back the patient because of infections. How will you defend this?
I will tell you that we are doing a lot of good things. The litmus test will be, you don't do open heart surgery in a place that doesn't have equipment, that doesn't have materials, consumables. Our theaters are stocked in a way that they have over a month's supply in advance. So if they finish what we bought for them for April, they already have the one for May. Before the end of May, they already have the one for June. Because we know theaters make money for the hospital. Theaters save lives. Our brand is very strong. People now come from the north, from Abuja, from the east, everywhere to attend hospital in LUTH, to attend clinics in LUTH. We are proud that we do a lot of neurosurgery, specialized operations like hip replacement. Go and check our operation list. I invite you to come unannounced. I can give you an open letter. Check our books. Go into the theater and see how doctors, nurses work, enjoying their work. So, but if somebody wants to denigrate a place for their own selfish reasons, they will look for all sorts of things to say. The litmus test is go there and interview patients on the ward and see the gratitude on their faces. I'm a surgeon of children. I operate on babies. I know how many lives. Till now, I still operate. I enjoy operating in our theater. Somebody very senior in government came to our operation theater a few weeks ago, and his comment was, this is like, as if you are in Europe. That is what we have. But you can't satisfy everybody. So there are people who want to say something negative about the place. They've been doing it for the past 3 years. So they won't stop now. Okay? If we are doing hip replacement surgery, cheaper, faster, okay, on Nigerians, in Nigeria, by Nigerians, we deserve the kudos, the praises, okay? We don't shout about it, but we deserve those the kudos, because how many Nigerians can travel to Dubai, to Egypt, to the UK, to the US? Some who even have the money may not even be able to travel because they will be so sick. We are saving them. That is what LUTH is all about. I am proud to be a LUTH surgeon. Even I operate in LUTH. I still operate as a CMD because I enjoy doing that. And I know what it used to be several years ago when our operation suites were shut down. We have revamped them. I invite you to come and check it out.
Do we have, how many theaters we have in LUTH? Because the way you are painting this, I'm believing it, but it's so different from what I was told.
I can't help what somebody who's hell-bent, what you should be asking is, why will anybody that works in LUTH be saying negative things about LUTH? I will tell you the ulterior motives they have. They will tell you, for example, that we have opened a private lab. Yes, we opened a lab in LUTH, but it's not a private lab. It was opened by LUTH Initiatives, an arm of LUTH that is more efficient at running events and things in the hospital. It's that lab the lab, the people that work in that laboratory in the accident and emergency are LUTH workers, LUTH technologists and scientists. In the first 26 days of that lab, it made 14 million naira. A lab that we set up with less than 20 million naira. Now, some people must be hurting from that. People who have laboratories outside, who used to divert LUTH patients there. Do you think they'll be happy? They won't. The money goes into the TSA account of government. And if they know anybody who is pocketing 1 penny out of it, what do you think they should do? They should go to the police or blow a whistle. But they can't do that because they know that the money goes into TSA. But they are not happy. So they won't like that kind of lab. Those who used to cause strike actions in LUTH every time. Don't you feel sad that we were on strike for 8 months in 2014 and we got paid? Who got cheated? The public. We are the custodians of the safety on behalf of the public. We must say the way it is. We should not use strike actions for dispute resolution because we are putting people's lives in jeopardy. I wouldn't take that. So when we're on strike, patients go to their private hospitals where they work and they get rich. That is why they keep calling strikes. Now that government has broken that and clipped their wings, they are not happy. That is why this orchestration of LUTH is bad. LUTH is not bad. LUTH is working. We in LUTH treat over 100 cancer patients on the only functioning linear accelerator in Nigeria now. Government bought 7 during about Obasanjo's time. It's all gone bad. We still manage to keep ours working. People come from all over Nigeria, West Africa. Are you going to say that is a bad thing? What will you see of many other places that those machines are not working? And that's not even the news. Very soon, we should be taking possession of very brand new machines in Nigeria again to do more so that it won't be 100, we'll even be doing more. That is not bad. We wouldn't have been able to make a case for that kind of thing if we were not working. If we were on strike, do you think anybody would believe in us to come and invest in us? The public, the private sector, they are beginning to say, what can we do for you? What can we do with you? Even if Nigeria has 1 good or 2 good teaching hospitals for a population of 20 million, it's not too many. If we have more teaching hospitals, it's not too many.
Well, I need to quickly go to this. Another allegation that the scan machine, LUTH used to have 4 scan machines, 3 are down, and LUTH is using only 1 for the multitudes of pregnant women coming to
You see, when people want to be economical with the truth, they will say all sorts of things. For a hospital like LUTH, you can't want everybody to line up in front of only 1 machine. The Department of O&G has its own machine. that they use for pregnant women in their clinic. That's enough, because not every woman that needs scanning in the clinic. In the IVF center, where Advanced Fertility Center of LUTH, which is doing very well, nobody will mention that to you because they don't want to mention the successes in LUTH. That place has its own scanning machine. We're even planning to buy a second one for them. Okay? Now, in the X-ray department, they have 2 brand new machines. But they won't mention that, or because they have not been working, those who make all this noise, they are professional unionists. You don't see them at their desk. So they don't even know when the grounds have changed. The department has to. We're even procuring more for them. So if somebody says there's only one in the whole of LUTH, that person is either not on ground to notice that we have quite a number of other machines. There are other departments that have their own machines. Doctors, ultrasound machines are now so common that doctors even have their own. Some doctors bring their own to work, to learn. Residents have ultrasound machines. So for somebody to say LUTH has only one machine is not really correct. It's not correct. And there is the same thing with many. You can talk about the salary, the salary promotion they mention. Now, promotion is not done only by LUTH. It is done in collaboration with people from the ministry who come, set the questions, mark it, interview them, collect the marks, and based on that, the profile of the person, they will announce this number is promoted, this number is not promoted. It's not the CMD that does it. It's not the director of administration. Promotion in any space cannot be for not everybody can be promoted, because if all of us become pastors, who will they be preaching to? If all of us become chief imams, then what will happen? Who will they be preaching to? So it's always like that. It's a pyramid thing. As the higher you go, there will only be one CMD. There will be a few principal officers, many seniors, and then the bulk will be those who really do the work. In LUTH, instead of pyramid, we have a barrel. We are top heavy. That shows that many people have been promoted. Our administration, for example, actually promoted the largest number of people who otherwise would have been stagnated. We submitted a list of over 600 people last year. Many were promoted. But those who had problems were either people who didn't get their BSc when they were, like they should have, and who were told you have to be at a bar. And they say, okay, after all, he carried and one last year. Many were promoted. But those who had problems were either people who didn't get their BSc when they were, like they should have, and who were told you have to be at a bar. And they say, okay, after all, he carried, and one other hospital has allowed some to go. You too should allow. It's not my decision. It's the decision of the supervising ministry. We have helped them. Go to the ministry. Go and state your case. We have also stated their case with the ministry. But if the ministry says no, am I, as CMD, going to say, countermand that decision? It's impossible. I also report to the ministry. They are being economical with the truth. If somebody is stagnated or stagnates, let's put it that way, on the promotion scale, everybody stagnates at a point or another. I can be promoted anywhere else. So that person has 2 options: to either accept what their station in life, or move out to a better place where somebody may say, I need you, you become the director. Is that not so? But you love your job, you want to stay there, and you say they must promote you. So there is a conflict there. Another thing again is that one must be careful for what one asks for. When you've stagnated for a number of years in the public services, they may ask you to go. So it's not something even I will shout about. I'm saying, leave them, let them be earning their pay. I hope you understand me.
Yeah, I do.
So it's not a decision of LUTH. LUTH conducts the exams with people from ministry and other aspects of government watching, and the result is submitted to Abuja. It's the ministry that now says, using our own rules, this is the line. You now come and start fighting LUTH because of that. You are fighting a rough fight, because the ministry is the ultimate arbiter.
Okay, with all this now, what is the way forward?
The big elephant in the room is the one you have not asked. the victimization.
They accuse you of victimizing
Yeah,
them.
I need to mention that so you understand the whole reason behind all this. I think they mentioned 3 doctors that they said were victimized by the hospital. In 2013, a doctor unfairly left a woman, a pregnant woman in labor, to rupture up, to die, let me say that. He was nowhere to be found. That was cruel. The board set up an inquiry. He was found guilty. He was dismissed. He calls that, the Association of Resident Doctors call that a victimization. In 2014 or 15, I can't remember, another doctor collected money illegally from a patient in the accident emergency building where he worked. He was suspended. While it was being investigated, he went to the ward and was reviewing a patient for his private ambulance business. The board got to know. The board investigated, and using due process, his appointment was terminated. He's also among the list of people that were said to have been victimized. The third one is the person I want to mention to you. This doctor is a resident doctor with us. He spent 12 years in the medical school instead of 6, always causing trouble. He was eventually, what I learned, was eventually rusticated. He found his way into the residency program. In spite of the largesse he got, the hospital sponsored him abroad to India to experience how medicine is practiced in other places. This doctor has been the rock behind a lot of agitations in Luth, because the only thing he knows is how to organize agitations. He was suspected to have been the one that organized the agitation on Wednesday. What did he do? Let me tell you 3 or 4 unethical things he did. There was a day, there was a strike. A consultant was in his clinic working. This doctor went and forced the patient to leave that consultation clinic and forced the resident doctors who were working to go and join them forcefully. He said he was picketing the hospital. It's illegal to picket a hospital. In the Nigerian law, it's illegal. When we queried him, he went to court. In fact, presently he has court cases against LUTH, against the ministry, against the National Postgraduate College, against everybody. You will commit an offense, then you go to court as a trainee. We won't take that. Then he went around threatening that he would shoot some officers of LUTH. We reported him to the SS, to the security services. They invited him. He has not shown up till today. I'm telling you that. This same doctor threatened publicly that there will be chaos in LUTH, that blood will flow in LUTH. As a responsible chief medical director, I must not allow that to happen. So when on Wednesday we got wind of their intention to cause mayhem, we had to put in security precautions in place. Otherwise, they would have brought in area boys from Mushi and Idiaraba, 2 hotbeds, hot spots. And then if they kill anybody, what will I say? That was why we inconvenienced Nigerians that. I'm sorry if anybody was in, for those who had difficulty in accessing us for those 2 hours that day. I apologize for that. But it was necessary to safeguard the safety of life and property within our space. Okay, that doctor is undergoing disciplinary investigations now, a process now. And the day he was invited by a committee to show up, he said the timing was too short, he will come tomorrow. That night, we started getting alerts saying that people should congregate in LUTH from outside, that they should join them in removing the CMD, in this and that. So all these frivolous allegations that they drummed up, none of them could stand the test of close scrutiny. If somebody says we are deducting his money, he shouldn't just go and dance on the street. He should go to the police. And that's the way it should be. They were just trying to give a dog a bad name so they could hang it. But the Nigerians are more discerning than that. People went to hospital, they saw that we are working, and good things are beginning to happen. Our power plant should come on stream. Our gas-fired power generation plant, which we did through a PPP, we will just be buying energy from them, should come on stream by August. That's good news. That's progress. We are going to be the first federal institution, medical institution, to have that kind of facility. That will ramp up our productivity, save us some money, put smiles on Nigeria. How many of us have uninterrupted electricity in our homes, in where we work? But this is going to have to be a first for LUTH. Okay, and we have been pioneering in so many areas, and I'm happy. Our water supply has been rehabilitated. It was left for more than 10 years that it wasn't working. It now supplies for over 40,000 gallons of water an hour. It's good water within the hospital, and so many other things like that. So when people say LUTH is not good, it's our duty to let people know that LUTH is working and people should come. The doctor that challenged doctor I mentioned, we must protect the integrity of medicine in Nigeria. We are the custodians of safety on your behalf and on behalf of the public. If we allow such a dangerous person loose in society, do you know what he can do? He may have to treat your relation or mine. Do we want somebody who's threatening to shoot people, who's threatening mayhem, and same blood will flow in LUTH? Is that the kind of doctor you want? Because we're investigating that so we can put in appropriate disciplinary measures. That's why he went to orchestrate all this. I can show you, and I will show you the text messages they sent around that day. It was frightful. And they asked people to come through the back door so that they will evade security. They should wear camouflage. Any responsible leader had to put in place what we did. Thank you very much.
How do we nip this in the bud?
It's a collective thing. I think what we are seeing, it's sad, but when you have people paid by government in these harsh economic times, when some states cannot pay full salaries, some states are paying half salary, some are not paying for several months, but people collect their salaries every month. Now dancing around trying to disrupt a system from where everybody benefits. It's a sad commentary on how far we have gone, especially when it involves people in the health sector, an essential service. Imagine if policemen are on strike or try to cause trouble. Imagine if soldiers try to cause trouble, or firemen. We are also categorized as essential services. So it's a collective thing. It shows how bad things have degenerated in Nigeria. We need to reinvigorate training. Our selection processes have to be better. So we know it's not many are called, few will be chosen. It's not everybody that has passion for this job. Nowadays, people are flocking to their sector because of better pay. That's what I say. So we, as a country, need to redouble our efforts at selecting the right people. People who have the milk of human kindness. Former Governor Fashola said, if we doctors, if nurses and health workers only know the power they have over life and death, they will not use strike actions as a form of negotiation in conflict resolution. That was what Governor Fashola said. We have a lot of power to do good. We should not allow people to turn it and use it for evil. So I'm appealing to you as well, the press, to help us. Let the people condemn such dastardly activities. Their mantra has been, LUTH needs to be saved. Save LUTH. I agree with them. We need to save LUTH. But from them, not from any other person. People who cannot see any good thing in their own country, who are not contributing. My question would be, what are they bringing to the table? We used to treat 150, 200 patients on our wards before. Now we have over 500. Our problem now is, let us buy more beds. Let us buy more of this and that. I'm happy with that kind of problem because that's what I want. I mean, if it were my private hospital, will I drive others away? I would take them. We take all comers. Okay? We assist those who cannot even pay up all their fees. We assist. They are Nigerians. They have a right to live. That place made us what we are today. We must serve our country selflessly. We should ask what we can do for that country. Not this allowance, that allowance, this allowance. No, government will pay. All those allowances are owed, but not only in LUTH, all over the country. You heard the vice president say the other day that the allowances that are owed, government will pay when government has the money. We need to be patient with government. That will be my take on that. Many of the things they said, most of the things they said were just things they needed to say, otherwise people will stone them out of the place. So they needed to say something, but it pales when you hold it against the light of truth. You find out that the LUTH is working. Now we have so many surgeries we are doing every day. Deliveries that used to be 30, 40 before in LUTH are now up above 100. Now that we are working fully, people are coming to believe in us. They said our accident emergency is congested. It shows that people believe in us. People are coming. We don't turn patients away. We treat them to the best of our ability. Okay? You can't do too much for people. Okay? I woke a doctor up. He was operating on a neurosurgical case all night. This morning, when I wanted to talk, he said, "Bro, I was on duty all night, operating." He doesn't know that patient from Adam. But God will write it down for him that you helped somebody. That's what we do. Not because of the money. Anybody that thinks it's because of money they want to come to LUTH doesn't belong there. It is to serve you and our countrymen. Thank you.
Thank you so very much, sir.
Thank you.
Oh.
Mabu.
Because he knew you were coming here. I don't know. He knew.
Show one time about it.
I know he must have felt bad. I want to do the Tuesday. Tuesday.
At the event that is overtaken.
I said that my boss, we have director of news, Mr. Osho, he said he'll give me query on Monday.
We rehabilitated it after 10 years. But she did. I need to me if I can. Tell your man complain for. Look, this is our IPP. Do I need to put it Independent Power Project? She because I hear be what you.
If my be my call on you.